Hello everyone. So the topic we'll discuss today is lipid metabolism. So at the first we will discuss about the types of lipids and classification. So let me tell you what are the major types of lipids. The major types of lipid are: number 1, fatty acid, triglycerides, which is also known as triacyl glycerol. Both are same thing, triglyceride or triacyl glycerol. Then glycerophospholipid, I'll write in short GP, glycerophospholipid. Then SP, sphingophospholipid or sphingolipid, in short sphingolipid. SL, sphingolipid, जगह छोटा पड़ रहा है. फैटी एसिड, ट्राइग्लिसराइड और ट्राइएसाइल ग्लिसरॉल, ग्लिसरोफॉस्फोलिपिड, स्फिंगोलिपिड, steroids and isoprenoids. This is the category of lipids. If I ask you a question, what is not derived from fatty acid? Like suppose the fatty acid is not the precursor to which thing? Triacylglycerol. Yes, triacylglycerol is made up of phospholipid. Phospholipid, yes, fatty acids are responsible for the production of phospholipids. Steroid and sphingolipid. So out of all this, steroid is the only lipid that is not derived from fatty acid, which is derived from isoprenoid. Steroids are synthesized from isoprene units, not directly from fatty acid, but triacylglycerol, glycerophospholipid, sphingolipid, they are all derived from fatty acid. But steroids, they are not derived from fatty acids, they are derived from the isoprenoids. If I ask you which is the simplest form of lipid, your answer is fatty acid. Let us discuss about, first of all, fatty acids. Let us discuss about fatty acid. Fatty acids are classified based on saturation. Based on saturation, they can be saturated fatty acid, SFA. They can be mono unsaturated fatty acid, or they can be poly unsaturated fatty acid. Saturated, mono unsaturated, poly unsaturated fatty acid. This is classification based on saturation. Next classification is based on chain length. Based on chain length, they can be short chain fatty acid, they can be medium chain fatty acid, they can be long chain fatty acid and very long chain fatty acid. Short, medium, long, very long. Short chain fatty acids have less than 6 carbon atoms. So maximum 5 carbon atoms is up to small chain fatty acid. If it is more than 5, so if it is 6 to 12, it is medium chain fatty acid. If it is 13 to 21, it is long chain fatty acid. And if it is 22 or more, it is very long chain. So 1, 2, 3, 4, 5 short chain fatty acid, 6 to 12 medium chain, 13 to 21 long chain, 22 or more than 22 is very long chain fatty acid. Based on saturation, based on chain length, we have classified the fatty acids. Third category is the essential versus non-essential fatty acid. Essential fatty acids cannot be synthesized. They are not synthesizable in our body, but the non-essential fatty acids, they can be synthesized in our body. What are the essential fatty acids? Essential fatty acids, we have omega 3 and omega 6 fatty acid. Omega 3 fatty acid which is essential is alpha linolenic acid, alpha linolenic acid, and the omega 3 fatty acid which is essential fatty acid is linoleic acid. So alpha linolenic acid and linoleic acid, these two are essential fatty acids. There is something called conditional essential fatty acids. Conditional essential fatty acids are fatty acids which are derived from these essential fatty acids, linoleic, alpha linolenic acid. So conditional essential fatty acids are fatty acids which are derived from the essential fatty acids like arachidonic acid, arachidonic acid. So once you get these essential fatty acids, you can produce arachidonic acid. Arachidonic acid, ecosa pentaenoic acid, then DHA, docosahexaenoic acid. Out of these, arachidonic acid is derived from linoleic acid, and these two, eicosapentaenoic acid and DHA, they are derived from alpha linolenic acid. We can get them even directly from food sources also. Eicosapentaenoic acid and DHA, they are available in fatty fish. देखिए जो fish oil है, the oil of the fish contains these two conditional essential fatty acid, docosa and DHA, docosa and eicosapentaenoic acid. And arachidonic acid, we get that from egg, meat. So arachidonic acid we get from egg and meat. Egg and meat. We get it from egg and meat. Whereas ecosa and DHA we get from fatty fish or fat oil or fish oil. So let me draw the structure of linoleic acid first. In linoleic acid, you have two double bonds, 2 dB, two double bond, and these double bonds are between C9 to C10, C12 to C13. You won't be able to remember that much, but remember linoleic acid is a 18 carbon structure. It's a 18 carbon structure which has two double bond, and these double bonds are from C1. If you go, first one is at C9 position, C9 to C10, and then you go from C12 to C13, and then you go up to C18. Here and here you have double bonds, C9 to C10 and C12 C13, linoleic acid. And now you can understand why it is called omega 6 fatty acid. It is called omega 6 clearly. This one is known as omega 6 because this is the omega position, C18 is the omega position. From this you have to go 18, from 18 first C17, C16, C15, C14, C13, C12. So from C18, between C12, from C18, if you have to go to 13, how many numbers you have to cross? 6 carbons you have to cross. From 18 to 12, sorry. From 18 to 12, you have to cross 6 carbons. So it is 6 carbons away from the number 18 position carbon. So that is what is known as omega 6. 6 carbons away from the distal end. That is the end where we have the carboxyl group, COOH. This is the 18th carbon. So from the 18th carbon, you have to go 6 carbon behind, and that is what is known as omega 6. And alpha linolenic acid, this is also 18 carbon fatty acid but has 3 double bonds, and these double bonds are positioned at The linoleic acid C9, C10, C12, C13, and then between C15 and C16, then finally C18 position. So from C18 to C15 the distance is 3 carbon. So alpha linolenic acid is a omega 3 fatty acid. Clear? So we have linoleic, alpha linolenic acid. This one has 2 double bond, it is away from the C18 position. This one has 3 double bond, so it is close to the 18th position. So this one is omega 3, this one is omega 6 fatty acid. Let's discuss about arachidonic acid, then we will understand few things about it. Arachidonic acid, this is a 20 carbon acid. This is a 20 carbon acid which has 4 double bonds. It has 4 double bonds, and precursor to arachidonic acid is linoleic, which contains 2 double bond at C9, C10, C12, C13 position. So obviously arachidonic acid will also have these 2 double bonds. Also arachidonic acid had 2 more double bonds. So better to remember it as one thing I mistakenly told you, that linoleic acid has the double bonds in this position. Also arachidonic acid will also have these double bonds, but no, the double bonds in arachidonic acid is C5, C8, C11 and C14. These are the double bond positions for arachidonic acid: C5, C8, C5, C8, C11 and C14. Okay, but the linoleic acid had double bonds at C9 and C12 position, C9, C12, but arachidonic acid has C5, C8, C11, C14 position. Because it is a 20 carbon amino acid, you can tell arachidonic acid is a omega 6 fatty acid. This is arachidonic acid, C5, C8, C11, C14. It is a 20 carbon amino acid, 20 carbon fatty acid, what am I saying, 20 carbon fatty acid, and the carbon C14 is the last double bond carbon, so it is 6 carbon away from C20, so it is a omega 6 fatty acid. It is also an omega 6 fatty acid like your linoleic acid, that is also an omega 6 fatty acid. So the derived product of linoleic acid, arachidonic acid, is also a omega 6 fatty acid. And the other 2 amino acids which are conditional essential amino acid, one is eicosapentaenoic acid, this one is also C20. DHA is 22 carbon fatty acid. So eicosapentaenoic acid, which has 5 double bond, it is C20 like arachidonic acid. DHA is C22, and they are both omega 3 fatty acids because their precursor alpha linolenic acid is also omega 3 fatty acid. You remember in omega linolenic, in alpha linolenic acid, the position of double bonds in ALA, alpha linolenic acid, the double bonds were C9, C12 and C15. This is a 18 carbon structure, so it was omega 3 because 18 to 15, 3 carbon gap. Eicosapentaenoic acid and docosahexaenoic acid, they are also omega 3. Now where is the double bond position in eicosapentaenoic acid? This is just like your arachidonic acid, that is C5, C8, C11, C14. So just like arachidonic acid, Eicosapentaenoic acid also has same configuration of double bonds C5, C8, C11, C14, but also it has double bond in the 17th position. So just like arachidonic acid, EPA, C5, C8, C11, C14, but it also has a double bond in the 17th position. So that is why it becomes a omega-3 fatty acid. And docosahexaenic acid, in that case you can remember that double bond is switched just one position before. So instead of C5 it is C4, instead of C8 it is C7, instead of C11 it is C10, instead of C14 it is C13, instead of C17 it is C16. But DHA has 6 double bonds and the last double bond is C19. So 3 carbon gaps always. So C5, C8, C11, C14 arachidonic acid. C5, C8, C11, C14, C17 eicosapentaenoic acid. C4, C7, C10, C13, C16, C19 it is DHA, and they are both EPA and DHA. EPA and DHA, they are both omega-3 fatty acid because they derive from the alpha linolenic acid, which contains double bond at C10, C13, C9, C12 and C15 position. Alpha linolenic acid has double bonds in the C9, C12, C15 positions. Ask you, what should be the ratio of omega-6 to omega-3 fatty acid in our body? Which one is more important? Answer is omega-6. The ratio is, optimal ratio demanded is 4:1. This is the omega-6 fatty acid, linoleic and arachidonic, derivative of linoleic, that is arachidonic acid, and omega-3 alpha linolenic acid and its derivative EPA and DHA. These 3 are required less, these 2 required more. We need ratio 4:1. Omega-6 more than omega-3. Coming to the classification of saturation. Okay. Saturated fatty acid, we have palmitic acid, stearic acid. Palmitic is C16, stearic is C18. Oleic acid is monounsaturated fatty acid. It is also like stearic acid, C18. The olive oil that we are talking about, olive oil contains oleic acid. Olive contains oleic. This is healthy for heart. Then PUFA, we have linoleic, which has 2 double bonds. Alpha linolenic acid has 3 double bonds, and arachidonic acid, which is derivative of linoleic acid, this one has 4 double bonds. We know linoleic and alpha linolenic acid, they are C18. Arachidonic acid is C18. From ALA we have 2 more fatty acids, EPA and DHA, and we know they are C20. So arachidonic acid is C20, EPA is C20 and DHA is C22. So we discussed about fatty acid, the most important acid. Then let's discuss about the membrane lipids. Lipids which are present in our cell membrane. Membrane lipids, we have glycerophospholipid, Sphingolipid and sterols. These 2 are derived from fatty acid. This one requires isoprene unit, sterol. Backbone of glycerophospholipid is glycerol. Backbone of sphingolipid is sphingosine, and backbone of sterol is steroid nucleus. So if a question comes on the basis of backbone, the backbone of glycerophospholipid is glycerol, sphingolipid is sphingosine, sterol is steroid nucleus. Glycerophospholipid, we have glycerol, where glycerol has the structure CH2 OH, CHOH, CH2 OH. This is glycerol, also known as glycerin. Glycerol is known as glycerin. So glycerin is nothing but glycerol. Glycerophospholipid, instead of hydrogen we have a fatty acid. A fatty acid, then here a fatty acid, and instead of this position we have a phosphate group. Clear? Fatty acid, phosphate. This is the structure of, now this is the structure of glycerophospholipid. This is the structure of glycerophospholipid. This linkage is the ester linkage. Important examples of glycerophospholipids. Number 1, phosphatidylcholine. Number 2, phosphatidylserine, phosphatidylinositol, and cardiolipin. These are your glycerophospholipids: phosphatidylcholine, phosphatidylserine, phosphatidylinositol, and cardiolipin. This one is the most abundant glycerophospholipid. Phosphatidylserine, it is responsible for signaling. Another glycerophospholipid I missed out, that is phosphatidylethanolamine. So 5 glycerophospholipids: phosphatidylcholine, phosphatidylethanolamine, phosphatidylserine, phosphatidylinositol, and cardiolipin. Cardiolipin is found in the inner mitochondrial membrane. The inner mitochondrial membrane. Phosphatidylserine is responsible for signaling of apoptosis. It's a signal for apoptosis. When phosphatidylserine is expressed on the outer side of the cell membrane, it is a signal for apoptosis. Phosphatidylcholine is the most abundant glycerophospholipid, and it is for the structure of the cell membrane. Phosphatidylethanolamine, this one is found in the inner layer of cell membrane and mainly curved membranes. Phosphatidylethanolamine. Phosphatidylinositol, we all know it is involved in signal transduction. We all know the pathway, which is predominantly a precursor. It's a precursor to the production of secondary messenger. From this phosphatidylinositol, we get second messengers. This pi breaks down into two things. One is IP3, other one is DAG. The form of phosphatidylinositol that is responsible for the production of IP3 and DAG is called PIP2. So it's a form of phosphatidylinositol. The complete name is phosphatidylinositol 4,5 bisphosphate. So 2 phosphates are added. Phosphatidylinositol 4,5 bisphosphate. TIP2. This will break down and become inositol triphosphate IP3 and DAG, diacyl glycerol. From the PIP2 cleavage, that is phosphatidyl anositol 4,5 bisphosphate cleavage, we get IP3 and DAG, inositol triphosphate and diacyl glycerol. This cleavage is conducted by the single enzyme phospholipase C, PLC. Phospholipase C cleaves the phosphatidyl anositol 4,5 bisphosphate into IP3 DAG. Phospholipase C. Then this IP3 will activate calcium release, anositol triphosphate triggers calcium release, and DAG activates protein kinase C. The backbone of all glycerophospholipids is phosphatidic acid, which is this thing, CH2O fatty acid, CHO fatty acid, CH2O PO4 2 minus. This is known as phosphatidic acid. In case of phosphatidyl anositol, the structure was PO4 minus attached to inositol. Then it will become phosphatidyl anositol. Similarly, phosphatidyl ethanolamine, instead of inositol, it will have ethanolamine, like this. For this IP3 and DAG, we know that IP3 is soluble. PIP2 is a structure of the cell membrane. It's a cell membrane structure. When it breaks down into IP3 and DAG by this enzyme phospholipase C, this IP3 detaches from the cell membrane and goes into the cytosol. This IP3 goes to the cytosol, whereas this DAG remains embedded in the cell membrane. This DAG remains embedded in the cell membrane. This IP3, as it is soluble, it goes into the cytosol and it attaches to the endoplasmic reticulum and causes the release of calcium from the endoplasmic reticulum. This calcium, which is released from the endoplasmic reticulum, this calcium binds to diacyl glycerol, and this diacyl glycerol plus calcium, they together activate, ये दोनों मिलके एक्टिवेट करते हैं प्रोटीन काइनेज सी को. दे टुगेदर एक्टिवेट दी प्रोटीन काइनेज सी. Discussed a lot about the first type of membrane lipid, that is glycerophospholipid. Now let us discuss about the second type of membrane lipid, sphingolipid, the backbone of which is sphingosine. We are not going to go into the structure of sphingosine. It is a very big structure. We have to know that sphingolipid is an important type of lipid which is especially important in the central nervous system. The neurons, their membranes require sphingolipid. The basic information about sphingosine, you should remember that it is a 18 carbon amino alcohol. It's an 18 carbon amino alcohol. It is an 18 carbon amino alcohol which has a very long hydrocarbon chain. Attached to this amino alcohol is a very long hydrocarbon chain. What are the classes of sphingolipids? Sphingolipids has class. So there are three classes mainly of sphingolipids. Sphingolipids have three classes. Number one, sphingomyelin. Number two, glycosphingolipid. And number three, ganglioside. So three types of the sphingolipid. We are talking about the membrane lipids. We know there are three types of membrane lipids: glycerphopholipids, sphingolipid, and sterols. Sphingolipid again has three classes: sphingomyelin, glycosphingolipid, and ganglioside. Sphingomyelin is the only phospholipid. So this sphingolipid contains phosphate group. It is the only phospholipid in the sphingolipids, sphingomyelin. This is mainly important for the myelin sheath of neurons. Next is glycosphingolipid. Glycosphingolipids are again of two types: cerebroside, globoside. So glycosphingolipid is of two types: cerebroside and globoside. And finally, ganglioside is the third category of sphingolipid. And ganglioside is what is given with the examples of GM1, GM2. ये आपने देखा होगा, GM1, GM2, like this, GD1. Okay. This is M. What is D here? So M means mono, D means di, T means tri, Q means quad. So it can be ganglioside M, that is ganglioside containing mono. Mono means single. Ganglioside, so I can write as GM, GD, GT, GQ. But what is mono, what is di, what is tri, what is quad? ये क्या है जो 1, 2, 3, 4 है? It is the number of sialic acid residues. So how many number of sialic acid residue are there? Whether it is single sialic acid, double sialic acid, triple, 4 sialic acid residue. Based on that, we have the numbering. So for the number of sialic acid residues present in the ganglioside, we call it GM, GD, GT, GQ. Further, what is the position of the sialic acid residue? Based on that, we have GM1, GM2, like that. Now, with sphingolipids, what is important is the clinical conditions. So I'll start with some questions and I'll go back to the theory part. So the topic we are going to now cover, sphingolipid storage disorder. Okay, it's a category under lysosomal storage disorder. Sphingolipid storage disorder. Okay, now tell me, in which lysosomal storage disorder in which sphingolipid storage disease is due to deficiency of hexosaminidase A. Which lysosomal storage disease or sphingolipid storage disease is due to deficiency of hexosaminidase A? Tell me your answer. Question number 2. This is the first question. This is question number 1. Which disease is due to deficiency of hexosaminidase A? Question number 2. Which enzyme is deficient in Niemann-Pick disease? Which enzyme is deficient in Niemann-Pick disease? For that, we have to go to the theory part. Okay. So first of all, Tay-Sachs disease, Gaucher disease, Niemann-Pick, which has again two types, type A and type B. Niemann-Pick, Fabry. These are all sphingolipid storage disorders. Fabry disease, Krabbe, and metachromatic leukodystrophy, MLD. My first question was, which disease condition is due to deficiency of hexosaminidase A? Which disease condition is due to deficiency of hexosaminidase A? The answer is Tay-Sachs disease. hexosaminidase A. I'll write in short HA. So the deficiency of hexosaminidase A leads to Tay-Sachs disease. Question number 2. Which enzyme is deficient in Niemann-Pick disease? In Niemann-Pick disease, which is again of two types, type A and type B, the enzyme that is deficient is Sphingomyelinase. Two questions, we know the answer. Which disease condition is due to deficiency of hexosaminidase A? The answer is Tay-Sachs disease. Tay-Sachs disease. And Niemann-Pick disease, the enzyme deficiency is Sphingomyelinase. So we know about Tay-Sachs and Niemann. Now we have to learn about the Gaucher disease, Fabry, Krabbe, MLD. In Gaucher disease, the enzyme deficient is glucocerebrosidase. The enzyme deficient is glucocerebrosidase, also known as beta glucosidase. So it is glucocerebrosidase or glucosidase. This is the enzyme deficiency in Gaucher disease. In Fabry disease, the deficiency is galacto. So this one is glucocerebrosidase and Fabry is galactosidase A. With Krabbe, the deficiency is galactocerebrosidase. So it is like the Gaucher. So Gaucher and Krabbe, they have something similar with the name of the enzyme. This one is glucocerebrosidase. This one is galactocerebrosidase. Glucocerebrosidase, galactocerebrosidase. Fabry, we have deficiency of glucosidase A. MLD, the enzyme deficiency is aryl sulfatase A. So if I ask you a question again, which condition is due to deficiency of hexosaminidase A? Hexosaminidase A, the answer is Tay-Sachs disease. Okay, next, which enzyme is deficient in Niemann-Pick disease? Niemann-Pick disease, which is of two types, type A and type B, we know the enzyme is sphingomyelinase. Okay, crumpled tissue paper appearance of macrophages. This is seen in, we all know, Gaucher disease. Crumpled tissue paper appearance of macrophages is seen in Gaucher disease. Which of the following Sphingolipid storage disorder is not autosomal recessive? So they are all autosomal recessive except one, that is Fabry's disease. This one is X-linked. Fabry is X-linked, other than all are autosomal recessive. Let us go back to theory again, theory part. Again we'll come to questions. So let us discuss about Gaucher disease, which is due to glucocerebrosidase. Can you tell me which disease is due to deficiency of galactosidase and galactocerebrosidase? Glucocerebrosidase is Gaucher. Which one is due to galactosidase? Which one is due to galactocerebrosidase? Can you remember? Yes. Fabry is due to galactosidase, which is X-linked. Fabry is due to galactosidase. Krabbe is due to galactocerebrosidase. Gaucher is due to glucocerebrosidase. Due to galactosidase deficiency is Fabry. Due to galactocerebrosidase deficiency is Krabbe. And metachromatic leukodystrophy is due to deficiency of aryl sulfatase A. I hope the enzymes are you can remember now. You know about Gaucher's disease? This is the most common lysosomal storage disorder. Even within the Sphingolipid storage disorder, it is most common, and overall amongst the category of lysosomal storage disorders, it is most common. So most common lysosomal storage disorder is Gaucher's disease. Very common condition due to deficiency of the enzyme glucocerebrosidase or glucosidase. Understand, if glucocerebrosidase is not able to work, what will accumulate? Glucocerebroside, because the enzyme sidase is not working. Glucocerebroside will accumulate. All of them are autosomal recessive except Fabry. And the gene for Gaucher disease is present on, this is the MCQ question. So most common lysosomal storage disorder, Gaucher disease. What is accumulating? What is the enzyme deficient? These things has to be remembered. Finally, the enzyme, finally the gene is known as GBA gene, present on chromosome 1. The full form of GBA gene is glucoceramidase beta A gene, because the other name for the enzyme glucocerebrosidase is beta glucosidase. You can remember it like this. Glucocerebrosidase also known as beta glucosidase. थोड़ा सा डिटेल में जाना पड़ ही रहा है. So because you can't, then I can't be able to explain you the name of the GBA gene. So glucosidase beta, G for glucosidase, B for beta, glucosidase beta. Okay, from there you can remember the gene which is affected in Gaucher's disease is GBA gene, because GBA stands for G for glucosidase, B for beta. Glucosidase beta. Actually, the name is not glucosidase beta. The actual name is glucosylceramidase beta gene. That is the complete name. Glucosylceramidase beta gene, which is present on chromosome number 1. But remember, in Gaucher disease, which is the most common lysosomal storage disorder, the enzyme defective is glucocerebrosidase or beta glucosidase, which is due to GBA gene, and chromosome number is 1. Purpose of glucocerebrosidase is to break down the glucocerebroside into two molecules, glucose and cerebroside. This was the purpose of glucocerebrosidase, but now this cannot happen, so glucocerebroside is accumulating. And this Gaucher has 3 types. Type 1 does not involve neuron, no non-neuron, it does not involve neurons, non-neuronopathic. But type 2 and type 3, they involve neuron. Type 2 is acute, type 3 is chronic. So you know that Gaucher disease has 3 types. 1 is non-neuron, type 2 is acute, type 3 is chronic neuron involvement. Because it is acute, so it is very lethal. The child will die by the age of 2 years. Before 2 years of age, the child will die. And in type 3, there will be milder neurological symptoms. The person or the child will have difficulty onset during childhood. So at the time of childhood or during adolescence, they will start to develop some neurological symptoms, type 3 people. And type 1 people will not have any neuronal involvement. They will have enlargement of liver and spleen. So hepatosplenomegaly, I wrote in short, HSM, hepatosplenomegaly, anemia, bone crisis. It's not just anemia, it is pancytopenia. Now, why pancytopenia develops in Gaucher disease? Why? Explanation of development of pancytopenia in Gaucher disease is that in Gaucher disease we have Gaucher cells. Okay, this is the term given to the lipid filled macrophages, also known as lipid laden. Laden matlab filled. Lipid laden macrophages. So the lipid filled macrophages will accumulate inside the bone marrow. The Gaucher cells will accumulate in the bone marrow. They will replace the normal hematopoietic cells, due to which there will be anemia, there will be leukopenia, there will be thrombocytopenia, because the Gaucher cell has accumulated the bone marrow. Okay, this Gaucher cell will also accumulate in the spleen. This Gaucher cell will also accumulate in the spleen and will cause massive splenomegaly. This enlarged spleen will further destroy the blood cells. So it is the infiltration of bone marrow that is replacing the normal hematopoietic cells, that is causing the decrease in the cell count, the cell production. Also, this spleen getting enlarged due to the Gaucher cells accumulation is also responsible for destroying of the blood cells. So दोनों तरफ से अटैक हो रहा है and as a result you are developing pancytopenia. Now these bones which are infiltrated by Gaucher cells, they will appear enlarged. Now Erlenmeyer flask deformity. Erlenmeyer flask deformity. This is due to the widening of metaphysis. This is due to widening of the metaphysis. So the shape like this. The diaphysis is narrow. This is the diaphysis. This is the metaphysis. The metaphysis is broad. Concept is due to why this happens is due to expansion of marrow. Here in Gaucher disease, the Gaucher cells are filling the marrow, so Erlenmeyer flask deformity will happen. But this is not characteristic of Gaucher, obviously, because any condition that can cause expansion of the marrow can lead to this appearance on X-ray, Erlenmeyer flask deformity appearance. Okay. So Gaucher disease, other than that, even Niemann-Pick disease. In Niemann-Pick disease also, this appearance is found. Then Gaucher and Niemann-Pick disease, there are other conditions like thalassemia, like osteopetrosis. Okay, these are also important causes of this condition, thalassemia, osteopetrosis. These bones, which are although widened in the metaphysis, but they are weak. So they are weak bones. So they have increased risk of fracture. So hepatosplenomegaly obviously will happen due to the compensation of the decreased bone marrow functioning. Due to the decrease in the bone marrow functioning, obviously the liver and spleen will try to compensate. Also, you can see the Gaucher cells are also accumulating in the liver and spleen, so that will also cause the enlargement of the liver and spleen. And also the compensatory mechanism will also lead the enlargement of liver and spleen. So the clinical features of Gaucher disease, we have hepatosplenomegaly, pancytopenia, bone pain and fractures due to again the bone crisis. Then we have avascular necrosis of femur, that can also happen. Erlenmeyer flask deformity, I explained you. And these Gaucher cells on histopathological examination will give you these Gaucher cells. Gaucher cells will look like a crumpled tissue paper. Of the types, type 1 is the most treatable form. Treatment is enzyme replacement therapy. Then we will replace the enzyme. We will give this patient the enzyme glucocerebrosidase, which is deficient. We will give him glucocerebrosidase. They are not effective for type 2 and type 3. Obviously type 2 is very lethal, and type 3. Why they are not effective in type 2 and type 3? Because these enzymes, they do not cross the blood brain barrier, so they are not effective in type 2 and type 3, the enzyme replacement therapy. There are certain names given to this glucocerebrosidase enzyme, but we don't produce the exact same enzyme, but there are enzymes like imiglucerase, so we give them IV. Okay, the enzymes are given in the form of IV infusion. They are not oral, obviously. IV infusion of these enzymes. We have imiglucerase, vela glucerase, tali glucerase. What do you see in common? Glucocerebrosidase, glucocerebrosidase, in short, glucerase, imiglucerase, velaglucerase, taliglucerase. They are given in the form of IV infusion, do not crosses the blood-brain barrier, so not effective in type 2, type 3, but effective in type 1. And there is a treatment which is oral for the this condition, Gaucher disease. The oral treatment is substrate reduction therapy. That means we reduce the production of the glucose cerebroside. Substrate reduction therapy, in this we are not breaking down the glucose cerebroside, we are just reducing the production of glucose cerebroside. We're decreasing the production of glucose cerebroside in this treatment called SRT. So ERT, enzyme replacement therapy, SRT, substrate reduction enzyme replacement. Confuse mat karna. Okay, so there are drugs like gluestat. Okay, so substrate reduction we have gluestat. So gluestat means something that is statting. Stat means stopping the production of the glucose cerebroside. Stopping the production of the glucose cerebroside. So gluestat, glucose cerebroside, in short glue, and stat means stop. Examples of gluestats we have gluestat, gluestat, gluestats. These are gluestats which are substrate reduction therapy, and they are oral, and they are only advised to patients who cannot tolerate ERT. ERT is the best. If they cannot tolerate, then switch to oral treatment, that is SRT, substrate reduction therapy, where we give gluestats, gluestats, gluestats. But the glucerase is the enzyme replacement of glucose cerebroside, imiglucerase, velaglucerase,